Okay, hey guys. Hey, in this episode, we're going to dive a bit deeper into inflammation. And in one of the first episodes, we talked, kind of laid the groundwork about uh, inflammation or pro-inflammation versus anti-inflammation, and how important it is to be able to keep those in the balance. And in that first episode, I hinted to the fact that I felt like probably most people were very much into the pro-inflammatory status, especially if we just kind of look at the research and look at all the chronic diseases that people are faced with. And so in this one, I want to take a little bit of a step back and kind of dive just a little bit deeper into it as well. And so, when we talk about inflammation, some inflammation is good, too much of it is bad, right? And it's kind of this Goldilocks principle, right? We don't want the soup too hot, but we don't want the soup too cold either. We need it just right. And it's kind of the same thing on this anti-inflammatory piece of it as well. We don't want too much anti-inflammation, but we certainly don't want too little either. And most people probably tend to, like I said, be way too good at the inflammation side of it and not so good at the anti-inflammation side of it. And so they end up with this imbalance where they are chronically inflamed. And so, you know, one of the first things I want to do is kind of talk a little bit about how can you tell which side of the equation you're on here. Are you doing pretty well? Are you matched up pretty good? Um, or are you, like most people, intending towards the pro-inflammation side? And so one of the first things to kind of understand, and certainly, you could get an entire degree, and there are thousands of pathways and books and chemicals and genetics and all those things that you could get into when we talk about inflammation. And we're going to try not to get too lost in the weeds in this discussion. Um, but one of the big things to understand with inflammation is that inside of the cell, we have what are called mitochondria. And mitochondria are what makes energy inside of a cell. And when we have chronic inflammation through a variety of different chemical cascades, one of the things that happens is we have this issue that's called mitochondrial phosphorylation or dephosphorylation. And basically, what it does is it starts to shut down the energy production of a cell. And so the cells can't make as much energy, and the energy that they try to make is less efficient. And so, kind of like, a car that's starting to leak some oil, right? And it's starting to burn the oil instead of just the gasoline. It releases a lot more toxic chemical. You can smell the smoke and do those things, although I don't suggest it. But, back in my former days when I rebuilt a couple of vehicles on the farm, and pretty much everything was always broken down, you kind of got used to, hey, this car is not burning very efficiently, right? And so I always kind of think of that in my head when I talk about this phosphorylation pathway, that they're just not burning energy as well. They're not getting as much power uh, from the engine that they should, and they're also releasing more toxin on the back end of it, right? If you will. And so when they release increased toxins, that's where the antioxidants come in and try to neutralize it. But from an inflammatory standpoint, kind of cycling back to the step one here, is that they reduce their energy production coming from within the cells. And obviously, if they can't make as much energy, one of the symptoms that a lot of people are going to experience is a loss of energy or more fatigue. Another thing that's going to happen is that cells can't replace as quickly and as efficiently and as completely as they once did. And so they start to end up with, from a chiropractic standpoint, a lot of times they end up with a lot more joint pain or overuse injuries and tendinitises and things like that. And a lot of times, patients will say, hey, I didn't do anything different. I don't know why I'm having this pain when it's a tendonitis. I explained to them that they've strained a ligament, they've strained a muscle, and they're like, no, I seriously, I haven't done anything more than what I've been doing. Well, and the reason a lot of times that this happens is because they're in this pro-inflammatory state and they can't make as much energy. So even though they're not necessarily putting more demand on it, that's what they're telling me, that I didn't do anything, right? I didn't go try to lift something. I didn't do anything like that. I didn't put a demand that should have caused an injury, but just the demand of daily life, because they can't keep that energy level up high enough. The demand that they're putting on it, even though it's not an excessive demand, they've lost energy and that demand stayed the same, but now they have this imbalance. And so they end up having this repetitive injury, right? And so some of the other things that kind of go along with it is, as we have an injury, if we're going to go down this pathway, again, we could go down so many different pathways, but I'm a chiropractor, so I'm going to keep it more in this pathway. Um, but as you have an injury, that creates a stress on the body. And one of the previous episodes, we talked about how what chronic stress or prolonged stress starts to lower that immune system. Um, but regardless, as inflammation increases and we end up in this pro-inflammatory state, our immune resilience starts to go down, but so does our immune tolerance. And so we end up with this overall lowering of the immune system to kind of cycle back into what we're focused on with immune function and immune health. And so, of course, as immune tolerance lowers, that means they become more sensitive to different things. A lot of times, food proteins, they things that they used to eat now bother them, right? Or maybe chemicals or allergies, things that didn't used to be so bad now start to get a little bit worse. And unfortunately, what that does is that also produces more inflammation, right? And so we end up, in these vicious cycles where we become less tolerant to our environment and the chemicals and the foods and the toxins and all those things. And so as we become more tolerant, we end up having more immune activation, and we end up having more chronic inflammation, which actually makes us less tolerant, which means we have more inflammation, which again means we become less tolerant, and it becomes this downward cycle, spiral, that starts occurring. And while at the same time, they're a lot of times lowering that immune resistance. And so some of the telltale signs, like I said, to know that if you're having inflammation going on in your body, or if you're pro-inflamed, is, are you fatigued? That's a telltale sign. Uh, as your exercise resistance really lowered, right? Like, I used to go for a walk for 10 miles. Now I can only go for a walk for a mile. It's pretty good probability that you have some inflammation issues going on. Um, Depression. So if we get into the brain, depression can cause inflammation. Well, and vice versa. Inflammation leads to kind of this leaky brain situation, which leads to depression. Um, and so, brain fog, inability to find words, these are all indications that the brain itself is actually inflamed. And perhaps the body's doing okay, but the brain is inflamed. So, especially in this time during this pandemic, a lot of people went into lockdown, they self isolated. And we'll talk more about what the impacts of that are. They got depressed. They started watching the news. Again, we'll get into some of these things. Um, and so then, it changes our chemical makeup in our brain as we become depressed. We crave more unhealthy foods, and that unhealthy foods promotes more inflammation, which again causes more depression, which causes, and we just have all these bad cycles. Um, when we talk about inflammation, one of the other things is to ask yourself, you have increased discomfort after exercising. And I'm not just talking like some sore muscles, like I really work that area out, but are you noticing that it's taking longer to recover, or that you're really just not enjoying it? One of the telltale signs for me in the office is, when a patient experiences more discomfort after a treatment, that's a good indication that they have this increased inflammation. They have this increased sensitivity within their body. They're not able to recover as quickly as they would. Another indication is morning stiffness. If that morning stiffness lasts longer into the day, and there's lots of reasons for this, and we'll talk about some of those. But one of the reasons for that morning stiffness a lot of times is chronic inflammation. And so, I know I'm using a lot of musculoskeletal things because that's the world I work in, but understand that those things are signs that we can utilize, body signals that's telling us whether we're in a pro-inflammatory state, or we're in good balance, or we're, perhaps maybe um, needing to do some work in that regard. So, what are some things that pushes inflammation higher? One of the big ones, I think, a lot of times is food triggers. We become sensitive to um, foods over time. Chemical and environmental triggers can be a big one. Um, Repetitive injuries. So this is kind of getting back into my world again, right? Like, um, patients come in with a repetitive muscle sprain, strain, or a joint overloading situation. That creates pain, which creates stress, which increase inflammation, which then makes them more prone to the next repetitive injury trauma, which makes them, and so they get stuck in all of these cycles. Um, Chronic infections can be very pro-inflammatory, like Epstein-Barr virus or maybe hepatitis, something like that. And then, of course, just chronic stress tends to put people into this inflammatory state. And so, how do we start to deal with this? Well, obviously, one of the first things is let's reduce some of the triggers to lower that pro-inflammatory status. The other thing is looking at antioxidants. And so our body makes antioxidants. It's very capable of doing that if we give it a good diet that's rich in antioxidants. And so there's really two big categories here. There's sulfur containing foods that we should eat. And then there's flavonoids. So basically, the more colorful the food is, like blueberries have one of the highest flavonoid contents. Beets have a lot of flavonoids. Flavonoids are like resveratrol, or curcumin is a flavonoid that I personally like to use a lot of. Um, and so what that does is that helps get those flavonoids built up to help get us into balance. Exercise is actually a really good anti-inflammatory if the body can tolerate it. So during an exercise, we get this initial pro-inflammatory response, and then it's followed by this anti-inflammatory response that comes over the top to squelch the inflammation that occurred during the exercise. And so you actually end up building this more robust anti-inflammatory pathway over time. And again, this is why oftentimes the first time you go to the gym, you feel increased soreness. The third, fourth, fifth, sixth time, you start feeling much better following the exercise with it. And so, you know, one of the things with the anti-inflammatory side of things to understand is that we need a certain, and we really should be getting these through our diet. And sometimes supplementation can be helpful if you know you're in this pro-inflammatory state, trying to meet that demand that you have. But in the pro-inflammation side, it tends to favor what we call this Th1 pathway. Okay, so Th1 is our body's attack response, right? So when a virus comes in, if we're in a Th1 dominated situation, it does a good job of eating up that virus or bacteria or whatever the case may be, neutralizing it quickly. Now, the trouble with Th1 is that it kind of think of it like the military, right? It's all these soldiers that come rushing in. Um, and so when they come in, sometimes they come in with, bazookas when they really just needed, maybe a couple of pistols, right? And so they come in and they start blowing everything up. And this is what leads to what you've probably heard about in the news is these people having these cytotoxic storms. They have this over acceleration of this Th1 or pro inflammatory, which is good as long as we can keep it in check. And so what's supposed to happen is we have this big rush of Th1 pro-inflammation. That's why we need some level, of inflammation here. And then we have this over the top come in, shut down the Th1 response with this Th2 response. And this is more the anti-inflammatory piece of it. This is more the carpenters, if you will, kind of come in and say, okay, we destroyed this compound, now we need to rebuild it. And it's that transition a lot of times that some people have trouble in. And so this is one of my concerns with some of the things that are going on the internet right now is they're really pushing a lot of anti-inflammatory, and for most people it's probably good advice. However, if we try to push the anti-inflammatory piece too high, we actually suppress that initial inflammatory reaction that we really need to be able to start to get the upper hand in the immune system And so we suppress those macrophages and things like that that come in and chew the things up. And so they end up with these larger viral loads if they're overdoing it. Now, again, like I said, it's all about balance, right? And so, but if they don't have a good anti-inflammatory response to come in up over the top of it, push it back down, then that inflammation can start to get away from them and lead to these cytotoxic storms that tend to happen. This is really why one of the reasons for why people with chronic diseases don't do as well with infections because they're already in this pro-inflammatory state already. And so then they are pushed into this direction, and then they get that nudge from the virus, and that puts them over the top, right? And so now they end up in these cytotoxic storms and really don't do as well. And so, you know, some key takeaways from this: assess your inflammation status, figure out if you are in a pro-inflammatory state. Self-assess, you know, are there triggers that you need to take away? Are there things that you're putting in your body that you probably know you shouldn't have? Um, are there perhaps some food sensitivities that you need to dig into? We can do some testing, do different things like that. So, you know, what is your inflammation status? And then second of all, you know, what's your diet look like? Are you getting the anti-inflammatory pieces of it? Are you getting those flavonoids? Are you getting those sulfur-containing foods? Like I said, like garlic and onions and the colors of the rainbow on your plates throughout the day. Are you really getting those antioxidants? You know, there's a time and place for supplementation, and we'll talk about some supplements later on in this series. But understand that it's a dance, right? You got to keep these two things in balance. So I know we went a little bit long in this one. Inflammation is certainly a very difficult topic to cover in less than 4 or 5 years. So I feel like I did okay in what 16 minutes. So anyway, if you guys like these, like them on Facebook, pass them on to friends, like us on YouTube. We'll be coming at you again tomorrow with some more information. So thanks for your time.